So as a woman, have you ever looked down there after having a baby and thought, what's that bulge? That wasn't there before. And if you have, I want to encourage you with something right away. You are not alone. And if we're meeting for the first time, my name is Dr. Tugbiyele. I'm a board certified fellowship trained urogynecologist in Metro Atlanta, and I've cared for thousands of women like you, day in, day out, with over the last 20 years with pelvic organ prolapse. That happens very commonly in young women, especially after having a baby, postpartum, or in women who are in perimenopause and menopause when hormone levels start to drop. And, this video was actually inspired by a patient I saw recently. She had just had a baby and she had a vaginal delivery. Her baby was a little on the larger side and she pushed for quite some time. She had a tear down below that required some suturing at the time of her delivery. And after a few weeks later, while she was home caring for her baby, for her newborn, she noticed something unusual. When she was cleaning herself, she felt and saw a bulge. And at first, she wasn't sure what it was. And like many women, she was busy taking care of her baby. She was exhausted and focused on her baby. But the bulge did not go away. She took a mirror and looked and realized it was something new. And at her 6 weeks postpartum visit, her OBGYN confirmed her suspicion. She had a bladder prolapse, also called a cystocele. And she was referred to see me as a urogynecologist. When I examined her, I confirmed that not only did she have a bladder prolapse, a cystocele, but she also had what we call a rectocele, which is when the rectum bulges into the back wall of the vagina. So she had bulges in two different areas. It was at that point that her symptoms made complete sense to her. For some time, she had noticed that she had to lean forward to empty her bladder. She was noticing that she had to strain more to empty her bladder and to pee. She even had to press on her lower pelvis to pee and keep her urine stream going. Her urine stream felt weaker. And then she also noticed that she started to wear a liner because she started to leak urine, and she had never experienced that before her delivery. And not only was she having these bladder problems, but she was also having these bowel symptoms. Her bowel movements were more difficult. She had to strain more. She had to lean back to finish emptying her bowels and press along the vagina to empty. And when she emptied, she didn't feel like she was completely emptied. She even noticed those stools, the consistency had changed. They were a little thinner. And even now she was scared about becoming intimate with her husband because of the bulge. Thankfully, her prolapse was caught early. She had a grade 1 prolapse of the bladder and the rectum that dropped partway into the vagina, but had not yet reached the opening. To simplify, as urogynecologists, when we grade prolapse, when the prolapse is halfway in the vagina, it's a grade 1. When the prolapse is at the opening to the vagina, it's a grade 2. When it protrudes past the opening to the vagina, we say it's a grade 3. And when it's all hanging out, it's a grade 4. So identifying and diagnosing prolapse is pretty important, and doing it early is important. We talked about different options. She was not interested in a pessary, and we talked about the benefits of pelvic floor physical therapy to get her muscles stronger, and she actually chose to be referred for physical therapy. And because she was still postpartum, she just had her baby, this is the perfect time for her to benefit from pelvic floor physical therapy because her prolapse was still early. And that is why evaluation soon after symptoms begin, especially after childbirth, matters so much, and it's so important. And so that brings me to the purpose of this video, which is to share resources. And if you're a woman listening to me and you just had a baby, or you had your baby years ago and you noticed a bulge since then, this video is for you. And I want to walk you through some trusted resources that you have available to you to help you understand what prolapse is, how to identify it, how to treat it early, and how to prevent it from getting worse. Why? Because you don't have to live or put up with it. You can have your quality of life back, your comfort, control, and your confidence back. And so today I want to walk you through some resources again that you have for pelvic organ prolapse to help to catch it early before it gets worse. So the first resource is on my YouTube channel. And so with this resource, I have recorded and created long form educational videos on pelvic organ prolapse, bladder leakage, pelvic floor physical therapy, pessaries, surgical and non-surgical treatment options, and what to expect after treatment. I've created videos for all of these things. And so if you have not yet subscribed, go ahead and subscribe now to the channel and hit that notification button so you don't miss future videos. So I've created a lot of long form content on YouTube. The second resource is my social media. I'm pretty much present on all platforms: Facebook, Instagram, TikTok, and LinkedIn. Here on YouTube is where I record more long form educational content. However, on the other platforms is where I record more shorter, practical, easier to digest, shorter videos to inform you on your pelvic floor health and to help you avoid misinformation. LinkedIn in particular is geared more towards my referring doctors and referring clinicians who are looking for a trustworthy colleague and urogynecology specialist to refer their patients to. TikTok and Instagram is where I create content for all women who are looking for shorter content videos and health tips. The third resource is my personal brand website, which is drtugbiyele.com. And here is kind of the hub of my personal brand, where I share information about pelvic organ prolapse and related conditions that follow prolapse, like overactive and overactive bladder, urgency, bladder leakage, constipation, difficulty with emptying the bladder or bowels, accidental bowel leakage or fecal incontinence, pelvic pain, constipation, problems with intimacy, pain with sex or pelvic pain. And there's a Choose to Work With Me page. There's a pelvic floor health newsletter or blog that you can sign up for. I have educational articles, patient testimonials, reviews, and resources for clinicians. And you actually have the ability to schedule an appointment. And there are links to my social media platforms on my website. So it's actually a one-stop hub, so to speak. Resource number 4 are educational materials. So on my website, there are links for educational resources there I've made available there, that literature that describe prolapse, treatment options. You can download it. You can download it to your phone. You can print it off. And these materials will help you understand your conditions better, both surgical and non-surgical options for various pelvic floor conditions. Resource number 5, my personal brand business Facebook page. So this Facebook group called Tugbiyele Urogynecology is a Facebook community where I share educational videos, health tips, and practice updates. The bonus resource is the APOPS group. And so as I promised, this is a resource. It's another powerful resource, and it's called the Association of Pelvic Organ Prolapse Support Group, APOPS, a Facebook group with over 30,000 women supporting each other. It's been around since 2010. APOPS helps drive awareness, advocacy, and action for women suffering from pelvic floor organ prolapse. They support women, provide community, and help women understand prolapse and how it affects physical health, emotional health, sexual health, social habits, fitness, and a woman's work life. And so if you're a woman listening to me and you've been dealing with prolapse, bladder leakage, bowel issues, pelvic pain, intimacy concerns, either since having your babies or since being in menopause, know that you don't have to live or put up with it. You do have options out there available to you that are safe and effective. There is help. And you also have resources available to you, like I've shared earlier, to help you improve your quality of life, comfort, confidence, control. And all of these things can improve. And so take full advantage of these resources. Imagine not having to deal with a vaginal bulge, being able to play with your children more comfortably as you raise them, being able to be more intimate and not be afraid or avoid sex because of the bulge. Imagine not leaking or peeing yourself, or having to avoid exercise, or wearing the big, bulky, expensive pads all day long because of either prolapse or leakage. All of this is possible for you when you have the right information and resources available to help you make the best decisions for your pelvic floor health. So if this video has helped you and has encouraged you, go ahead and again, subscribe to this channel, like the video, and share with a friend who needs to watch this too. And I'll see you in the next video.